Hey, good afternoon, everyone. Thanks so much for joining us here on Facebook Live and on WKRN.com. I'm Josh Breslow. We know a lot of you out there do have questions about the COVID-19 vaccine and the rollout here in Nashville, so we wanted to help get you some answers to all those questions out there. We decided to bring in the real expert here, Dr. Alex Jahangir, the head of the Coronavirus Task Force. Dr. J, thanks so much for being here with us to talk about this.
Well, truly my pleasure. Thanks for having me.
We appreciate it. Okay, so we already got a few questions coming in, but I do want to remind anyone watching here, submit your questions there in the comments section, and that way we can ask them live here on the air. So up first, one of the questions that we have heard time and time again over the last few weeks, people who have had COVID-19 want to know, do they need to get their vaccine? What would you urge them to do?
Yeah, I think short answer is yes. When you have COVID-19, what has been shown is there's not a reliable antibody response. Where the vaccine, we know the scientists have shown that you get a very reliable response that gives you immunity for a long time. So the recommendation right now is anyone that's had the disease to get the vaccine at about 90 days after they've recovered. First, it gives you a long-term immunity. But secondly, there's some research actually showing that people who have what they call these long hauler symptoms, so fogginess, maybe some sensory issues, taste, smell, etc. Getting the vaccine actually helps resolve some of those symptoms too. So I think there are a lot of benefits to getting the vaccine after you've had COVID, but typically they say wait about 3 months after you've recovered from getting it.
And that was another question that people were wondering is how long do you have to wait? So the other question here that we've been hearing a lot, and we actually kind of got some answers from Pfizer this morning, was about how long people are protected from the virus after they do have the vaccine. And it sounds like right now it might be at least 6 months based on what we learned this morning.
Yeah, and I think it's an interesting point you bring up is that yesterday, if you asked me this question, the answer is we're still figuring it out, and that is still the thing. Pfizer said 6 months, and that's because it's probably how long of data they've had since when their trials are going on. But what if this shows out to be a year or 2 years? Nobody really knows, but what we do know is it consistently allows you to be protected, and I believe the Pfizer data actually showed there protects you against the variants that everyone's very concerned about right now. So another great reason to get the vaccine. Now, we may very well in a year or 2 years have to get a booster shot, but the best way to get success though right now is to get it now, and let's see how this train takes us.
So we actually had that mass vaccination event over at Nissan Stadium, more than 10,000 people vaccinated in one day. Do you know of any plans to hold another vaccination event like that? Because that's another question people are wanting to know is when can I go and do a drive-through?
That was such a great event, right? We did 10,107 individuals who received vaccine and were fully vaccinated after one dose with the Johnson & Johnson vaccine. We may not do one with 10,000 people anytime in the future. Really, it really depends on supply of Johnson & Johnson that comes to us from the state and then to the state from the federal government. We do have, hopefully, are getting it some more Johnson & Johnson soon, and we're looking into maybe doing maybe not a big one-day event, but a drive-through kind of spread out over a week and 2 weeks and 3 weeks and 4 weeks. We're working on those details. And so we are going to try to do that with Johnson & Johnson. And the benefit of Johnson & Johnson is you don't have to come back for a second shot. And so it really depends on supply. As you saw yesterday, Johnson & Johnson announced that one of their facilities that were going online, I believe I forgot what state, somewhere in the Northeast, had some manufacturing errors. So 15 million doses of Johnson & Johnson that was supposed to come out is now not going to come out. And so that may delay some of that supply chain. I want to reassure anyone that has received Johnson & Johnson in the past, including our event, the doses you got were not a part of this impacted. And also any doses of J&J that we are getting, we're also not impacted. So I really want to try to get this out. There are drive-through options throughout the region and other counties right now, but hopefully we'll have a good, reliable option here within Nashville as well soon.
What about the mask mandate? That's been in effect now for quite a while. We have seen some of the counties that are around Nashville say, okay, we've seen the numbers go down. We don't need this mandate anymore. Are there any plans for Nashville to lift the mandate anytime soon?
Yeah, our mask mandate went into effect at the very end of June, maybe the first week of July. And we were one of the first in the Southeast to take the leadership in doing that, and I'm proud of that decision still. And I think studies have shown that masks prior to the vaccine were the most effective ways to minimize the spread. And so as we are progressing to a good point where more and more people are getting vaccinated. 28% of Nashvillians today have started the process. I think it's just a little premature to lift the mask mandate. I think the CDC has put out recommendations of, let's say you're in a group where everyone has had the vaccine, you don't need the mask. So the more people get vaccinated, the less and less you're going to need the mask. But we're not at a place in our city that you can just go out in the street and you're more likely to run into someone that's been vaccinated or not. So we're still going to require the mask mandate for a little bit longer. And we may amend it a little bit as the situation allows, but we're still going to press on. We're almost so close to the finish line, and we want to make sure we reach that before we lift all these restrictions like that.
And this question kind of goes along with that here. As far as reopening Nashville, is there even a timeline for when the city returns to normal, so to speak, for businesses and tourists and things of that nature?
Well, yes. Just I guess a week ago, we had 20% of people vaccinated, and we opened up a lot more as far as conventions, being able to be at outdoor venues like Nissan Stadium, Ascend Amphitheater, 33%. Our next goal is at 30% of people who receive their first shot. So we're 2% away from then rolling into even more people being allowed at venues, outdoor, indoor. So we're turning that dial fairly quickly, but we're turning that dial in relation to more and more Nashvillians being protected. What I want to make sure is all Nashvillians have the opportunity to be protected with the vaccine, right? So if you go out to a restaurant or a bar, we choose to go there, but the people working there don't necessarily have that choice. But I want them to give them the choice to protect themselves by getting a vaccine. So as more and more Nashvillians become protected, I think we definitely want to get back to the Nashville we all loved right before all this. I more than anyone else, I promise you. But we just have to just hold for just a little longer, but we're almost at that finish line.
Is there a difference in the vaccines and who should get each one of them? Somebody says, okay, well, I'm totally healthy. I'm 23 years old. Is the Johnson & Johnson one better for me? Is the Pfizer one, the Moderna? Is that how it works, or is it kind of just get whichever vaccine you can?
It is get whatever vaccine you can as soon as you can. And I think a great example is what happened with Johnson & Johnson yesterday, right? We are seeing more and more supply of Johnson & Johnson, Pfizer, Moderna. But just yesterday, as we talked about a minute ago, Johnson & Johnson's supply chain got disrupted, right? So we know what availability there is now. You should get what you can fast. All the vaccines have been shown to be almost 100% effective against getting people who are sick to the hospital or dying. They have just some minor differences in percentage of people who may get ill, just a light illness. But they've all shown to be so effective. As you all probably know now, Johnson & Johnson is a single shot. It's a little easier to store. So it makes it really great to use for those like mass vaccination events or for mobile events that we're doing. But all three of these vaccines, and possibly very soon a fourth vaccine, are all been shown to be very effective. Please get whatever vaccine you can. The sooner you can get it, that should be one's drive. And we have a lot of opportunities for Pfizer here in the city. As I said, Johnson & Johnson when available, and all around our state, Moderna, there are a lot of opportunities.
And we kind of already touched on this, but I do want to go through some of the questions that we are getting from people who are watching. And Carrie Gregg said, will this be like the flu shot? Will you have to keep getting it every year? And that we really, I guess, don't know at this point, right, what the future holds.
We don't. I mean, if you think about the first case of COVID hit Nashville on March 7th, the U.S. shortly thereafter, the studies around the trial for the vaccine started, I think, end of March. So we really are just about a year in, right? So we don't know. The Pfizer data you mentioned that said it's good for at least 6 months is promising, but we just don't know. And but again, that's why getting vaccinated is more reliable than relying on immunity based on getting sick. Because then once we do have that data, then you'll know, hey, I've been vaccinated. I know my immunity is good for blank. So.
And what about students? Because we've been looking at some of that Pfizer data. They've said, that it is safe for certain ages and up. Any idea when we're going to start being able to vaccinate students? Is that even going to be able to happen this school year? I mean, we're getting kind of close to the end here.
Well, any student that's 16 years and up can get vaccinated today. So that's step one. That's what it's been approved for, the Pfizer vaccine. Moderna and Pfizer are both studying 12 to 16, as well as I've heard even 6 months old and up. That data hasn't come out yet. I heard Dr. Fauci saying that the 12 to 15, 16-year-old range may be able to be cleared in time for the next fall, and then the age range below that maybe by winter semester of I guess that'd be 22. So a little bit longer. They're going through the clinical trials right now to ensure its safety and effectiveness seem to be good. But it's just going to be a little longer. But anyone 16, 17, you want to, enjoy the last few months of your high school years, this is the time to do it. Get a vaccine.
What about more appointments? I know they filled up pretty quick yesterday when they were opened. Music City Center, I believe you guys are going to open some more appointments for that tomorrow. Is that correct?
That's right. Tomorrow we're opening up more, maybe 10,000 or more. We actually are increasing. We initially were about 1,000 a day to 1,500 a day. Now I think we're up to 1,800 a day at just the Music City Center, right? There are also other sites around the city, pharmacies, health systems, so forth. Vaccinefinder.org. Again, vaccinefinder.org gives you a really great idea of what's all around us. So not even in our county, even other counties, is there some supply elsewhere? But we're getting a great amount of vaccine for our city's operations, and we have a lot of appointments that definitely tomorrow will be opened. And if you may need to wait a week, but we'll have your appointment that you need sooner than later.
How do you think the city of Nashville and Davidson County in general is doing in general right now as far as compared to the rest of the state and the country when it comes to getting vaccinated?
As I mentioned, we're at 28% of the 700,000 Nashvillians being vaccinated. And that number includes our children right now who can't be vaccinated. So if you take out the children, about 21, 23% of our city is children. So we're doing well. We're doing a little bit higher than the state average, and we're doing better than a lot of our surrounding counties. So I'm really proud of what we are doing as a city. I'm proud of people's commitment to this. Proud of the people in public health who are setting up all our systems and our health systems and other partners such as Neighborhood Health, Matthew Walker, Meharry, who are really helping get everyone access to the vaccine. 65 years and older, 65 years and older in Nashville, almost 70% have been vaccinated. And whether you're white, black, or of Hispanic ethnicity, 50, 60 plus percent of those individuals have all been vaccinated as well in that age range. So I'm proud of also not only getting people vaccinated, but trying to do it in a manner in which all people in our community get vaccinated at an equal rate.
Another person here, Maribeth Burns, asking, can you actually get your second dose at the Music City Center if you didn't get your first one there? The preference is that you go to wherever you where you initially received your first dose, because the way the allocation happens is you receive a vaccine, let's say in Williamson County, the state will then give 3 weeks later a second vaccine in Williamson County for you. Now, let's say you get your Pfizer vaccine and you can't mix vaccines, right? So if you're Pfizer, you're Moderna, you're Moderna. But let's say you get your Pfizer vaccine in, I don't know, New Jersey. And you're a Nashvillian, and obviously it doesn't make sense for you to go to New Jersey. We'll make certain exceptions, and you can go to Music City Center and explain that to them. Take your white card that shows that you are, that you had your first shot, that it was a Pfizer. We'll try to work with you, but it's not something we encourage, and because again, the vaccines are allocated in such that if you get one dose, the second dose is going to follow where the first dose is. But obviously there's certain extreme exceptions that we want people vaccinated. So we'll try to work with you. And you're a very busy guy, so we got to let you go in a second so you could perform some surgery and do your other job here. But really quickly, I just want to ask you, what would you say to people who are kind of on the fence about getting the vaccine in general? They live here in Nashville, surrounding counties, and they say, I don't know, I'm not sure if I trust this research, or, more research needs to be done. What would you say to them to tell them to go get vaccinated?
I'll tell them to, first of all, there are I understand people's hesitancies, but I also want them to look internally to see why are they hesitant. Are they hesitant because they've read legitimate resources, they've talked to their healthcare providers, or are they hesitant because they're buying the hoopla that's out there that is based on fear and an agenda that really is not based on fact and science. This vaccine is proven to be safe. This vaccine is proven to save lives. It's been proven that's the best way to get us back to where we are all want to be. But I just ask people to just don't just trust the hive, as they say, right? Do your own research, use legitimate sources, talk to people who really have thought through this and get your questions answered. And I hope that by doing that process, people who do have hesitancy will see that it makes sense for them to get the vaccine. But again, I don't want to disqualify anyone's hesitancy, because I think there are some really some very good reasons to have some concern. But let's get those questions answered. Thank you.
All right. Dr. J, thanks so much for joining us here. We really appreciate it. I know you're a busy guy, so I appreciate you taking the time to talk to us and answer some questions.
Truly a pleasure. I really appreciate all you guys are doing.
All right, and thank you so much for watching. We're going to post this full interview here in the question and answer session on our website. Head to WKRN.com, and hopefully we can do more of these every couple of weeks. Have a good one, everyone.